Welcome to SoftLab 4.5 System Workflow for Lab Orders. Many diagnosis and treatment decisions are based on laboratory results. Lab test results comprise the majority of the average patient's medical record. The reporting of accurate lab results is imperative for accurate diagnosis and treatment plans. The purpose of this training module is for you to be able to understand the system workflow of a lab order and your part in providing our patients with the best possible care. We will start with an overview of the system workflow for lab orders. Then we will take a look at the SoftLab labels, label printing, and how to properly label a specimen. Let's take a high-level look at the system workflow of a lab order, along with the responsibilities of the person obtaining the specimens. Lab orders are placed in ProTouch, which communicates with SoftLab to print labels. I will talk more later regarding the scheduling and printing of labels. The labels are removed from the printer and taken into the patient's room. After the blood has been obtained, the specimens are labeled and then must be charted as collected in ProTouch, preferably while still in the patient's room. The next step depends upon the requirements of your site. You may need to create a task list in the SoftLab system before sending the orders to a lab, or your site may send the orders without creating a task list. Please check with your lab champion for your specific process. A courier will take the specimens to a laboratory where the testing is performed. Results will be sent across an interface through SoftLab. SoftLab will communicate with ProTouch so that the results will be available in the patient's record. If this is a stat test, and if the orders have been sent to a non-kindred lab, then the results will be called to the patient's nurse. Let's take a closer look at the first step that I mentioned, placing orders in ProTouch. Orders should not be timed, unless, of course, it is appropriate to do so, like in the case of a vancomycin trough or other drug level, or maybe for a patient who is on dialysis and the draw should not be done until after 9 a.m. If there is not a specific reason for a time to be designated, then let ProTouch default to the routine time set at your site. Leaving the orders to default at the routine time will allow the SoftLab system to combine any duplicate orders. So for example, if you have one doctor who ordered a routine CBC and then another doctor orders a routine H&H, since the H&H is part of the CBC, the H&H will automatically be canceled by SoftLab as a duplicate order, and SoftLab will only print one label. If a timed order is indeed needed, the labels for those tests will print around 90 minutes to 2 hours before the blood needs to be drawn. The labels for the morning routine draws will all print in one batch as a designated time for your site. Now when stat or as soon as possible tests are ordered, those labels will print about 3 to 5 minutes after placing the order in ProTouch. Make sure that these labels print before charting those orders as collected in ProTouch. So if you don't wait until those labels print and execute those orders, then those labels will not print. When a urinalysis or culture is ordered, the label will print immediately also. You may need to hold these labels for the urinalysis until the patient is able to void. So check with your site-specific location where these labels will be located until a specimen is able to be obtained. Once the labels print, they will need to be removed from the printer and separated by patient. The labels are taken into the patient's room where the specimens are obtained. These two labels are specimen labels. Notice that there are two tests for this patient. There is a basic metabolic panel, or BMP, and a ProTime, or PT. So each test will be in different tubes, hence two labels. These labels, the ones with the barcodes, are the labels that will be used to label the specimens. Let's take a look at the components on these labels. Here you see the patient's demographics, the patient's last name and first name, the patient's age, gender, and date of birth. Under the patient's name is the medical record number, and to the right is where the patient is located in your hospital. Next is the specimen information. Here we see the tube type, the number that is associated with this barcode. The test priority is here. This is a routine test. If this were a timed order, it would say timed instead of routine, and this is where the time would show when the order needs to be collected. Next is the order number and the order number abbreviation. And we have already looked at what tests are ordered. If multiple tests are requested that can have the same tube type, then you could have multiple tests listed on the same label. This is the workstation. This information is different for each hospital and will determine where your specimen should be sent. And one last thing before we move on. This is the area where the person obtaining the specimen will initial and write the date and time of collection. For any urines and fluids, you should also include source information. The next label has additional information. You can see the patient's diagnosis here. And these numbers correspond with an exam ID number that is in ProTouch. And I will show you an example of the exam ID shortly. You may also have comments that were included when the order was placed, like draw after dialysis, or maybe a comment regarding how to handle a specimen, as in the case of an ammonia level, where the comment would say, place specimen on ice. The last label in the group has demographic information and includes the ordering physician's name along with the tests that were ordered. After labeling your specimens, these two labels should be shredded since they contain patient information. Since the SoftLab system uses a scanner, it is very important that the labels are affixed to the tubes properly. Place the label on the tube under the stopper. Make sure that the order number is at the top of the tube and the label is straight on the tube, as you see in our example. This will allow a much smoother process for the person responsible for scanning the samples with a barcode reader, and for the lab staff as well, since the instruments in the lab also use barcode readers. After the blood has been drawn, or the urine or microsamples have been obtained, the next step is to execute the orders in ProTouch. The orders must be charted as collected in ProTouch. This is a very important step, as the orders cannot be processed in the SoftLab system unless they have been executed in ProTouch. If the orders are not charted collected in ProTouch, this delays the patient's results. From the Full Chart function screen, access Nursing Actions. Locate the order, and here, notice the exam ID under the order. Remember, this number will match the number listed on the SoftLab label that had the ProTouch information that I mentioned earlier. Tap or click the order. Tap or click Collect Specimen. Since you're in the patient's room and just obtained the specimen, you would click Now. Or if necessary, use the other options to document the correct collection time. Tap or click the appropriate role. Use this screen to designate where the blood was obtained. Was it a peripheral stick or a line draw? You may have additional orders to execute. Go ahead and chart those orders, and then process as normal. In this module, we looked at an overview of the system workflow for lab orders, SoftLab labels and when they print. You also learned how to properly label a specimen using the SoftLab labels. And now, let's see how much you remember.